Julie, I'm here today with Dr. Jeff Ripperda, a Murfreesboro doctor who's been recommending the COVID vaccine to his own patients for months now. He's here today to help alleviate some of the fears that our viewers have about the COVID vaccine. Dr. Ripperda, thank you for being here today.
Thanks for having me.
Well, the first question I have is, some people are concerned because the vaccine doesn't have FDA approval yet. So what do you have to say to that?
I think it's a fair criticism of the FDA to ask why they haven't approved it as of yet. Typically, the FDA requires 6 months of studies on a medication before they're going to go ahead and approve a drug for full usage. We have way more than 6 months of data on all of the COVID vaccines that are approved in the United States right now. The FDA is being a little slow, though, because there's so much research going on with the vaccines that they keep waiting for more and more research to come out. So I actually think it's a little bit of a criticism that I have of the FDA to say, hey, you guys really should have approved this by now. There's no reason not to. But just remember, the FDA approval doesn't really change anything. The vaccine still is what it is. If the FDA approves it, it doesn't change what actually goes on in your body if you get the shot. So it's nice when the FDA approves something, but does it actually change how the vaccine works? No, it doesn't.
And some people say that the research was way too short on this vaccine.
So I think what you have to understand about how a drug is approved in America is that typically, again, 6 months are required of study of the medication before the FDA is going to say, hey, this medication is approved and safe to use. For the COVID vaccine, they shortened that to just about 3 months, give or take. But that's because when the COVID vaccine was approved, there were about 3,000 people in America dying every single day. That's the equivalent to the number of citizens we lost at Pearl Harbor or the number of citizens we lost at the 9/11 terrorist attack every single day to COVID. So I would argue that it would be foolish of the government and of our health officials to wait the full 6 months when you're losing 3,000 people a day. And it's not like there was no data on the COVID vaccines. The vaccine had been studied in tens of thousands of people for several months to that point when emergency approval was granted. And at this point in time, the COVID vaccines are the single most studied medications in human history. So to say that there's not enough study out there, if you compare the COVID vaccines to just about any other medication that you or any other human being has ever put in their body, we don't know as much about those medications as we do about the COVID vaccines.
Now, we had some viewers who asked about fertility and how the COVID vaccine could affect that.
So the myth that the COVID vaccines affect fertility came from one offhand comment. There was a gentleman who used to be a high-ranking official for the Pfizer Corporation who noted that the protein that the vaccine attacks is similar to a protein found in the human placenta. And he said, hey, maybe we need to look at this to make sure that the vaccine doesn't provoke an attack against the placenta or something like that and cause the risk of infertility. And that's a little out of sorts. In other words, that one comment has led to all sorts of harm and all sorts of misconceptions. There's been a ton of research on this. There's no evidence whatsoever that the vaccines cause infertility or that they cause any problem for pregnant women. And I can tell you that I personally have had multiple pregnant patients, first of all, who had COVID. They did okay, they got sick, but they had happy, healthy babies, and also who have gotten the vaccine without any issues. And if you don't believe me on that, you can check the American College of Obstetrics and Gynecology. They are the biggest group of experts in the country, whether you know it or not. If you are pregnant or have ever received female reproductive health care, the American College of Obstetrics and Gynecology has guided your care. They say that it is perfectly safe and acceptable for pregnant women or for women who plan to get pregnant in the future to get the vaccine. So the best experts we have in the country say that it's safe and that it doesn't affect fertility.
Now, there is a misconception that people who are healthy can't really get sick from COVID, so they shouldn't get the COVID vaccine. Now, how do you respond to that?
Yeah, I think there's kind of two reasons that healthy people can look to get the vaccine. One is to prevent themselves from getting COVID. Now, the odds of a young, healthy person getting super sick from COVID and dying from COVID is very small. It is still possible, but it is honestly pretty unlikely. The bigger reason is feeling some sense of responsibility to your fellow citizens, to your family members, to the people you're interacting with. A 25-year-old who's healthy and has no health issues can get COVID, spread it to somebody who spreads it to somebody else, who spreads it to another person who then dies. So they are sort of a step in the chain. And a lot of people don't necessarily feel that personal responsibility to say, hey, I need to take myself out of that chain, because by the time you get COVID, get sick, get over it, you don't really know where the virus goes after that. There's no way to track that. But I think if the number of young, healthy people who had COVID knew how many other people they had spread COVID to, and maybe even been implicated in the deaths of some people with COVID, that would change those feelings quite a bit. So again, for most young, healthy people, getting the vaccine is not really about protecting yourself. It's about protecting your community and making sure that your elderly aunts, your elderly neighbors, your elderly grandparents don't get COVID and die.
Now, there are some people who get side effects from the COVID vaccine, and there are people who are more worried about the effects of the vaccine than actually getting COVID.
Yeah, so you can look at all sorts of research on this, and there are some possible side effects to the COVID vaccine. Serious side effects are exceedingly rare, but they do happen. But I'll tell you this, in my own practice in Murfreesboro, I have had 6 patients die of COVID. I've had another guy who's in the hospital who is probably not going to make it right now. And I've had 3 patients become permanently disabled from COVID. The worst side effect that any of my patients has had from the COVID vaccine was done and gone about 2 weeks later. So the fear of something that might last 2 weeks versus the fear of something that might kill you, really, if you're doing a risk-benefit analysis, that should be very easy when you decide, hey, what's most likely to harm me versus what's most likely to benefit me.
And we do know that people who get COVID-19 have antibodies that can protect them from getting COVID again. Should those people still get the vaccine?
Yeah, there's this really cool thing with the COVID vaccine that has never happened with another vaccine that's been studied, and that's with the vaccine, you actually get a higher level of immunity against COVID than you do by having the disease. Never in human history has that happened before. Every single other disease that we vaccinate against, if you get the disease, you have a higher level of immunity than you do if you get the vaccine. And we know that the immunity to COVID fades over time. It fades with the vaccine some, it fades with the disease some. The disease hasn't been around long enough to know exactly how long the immunity is going to last, but it looks like it actually lasts longer with the vaccine than it does from having had the disease. So even if somebody has antibodies from having had COVID, that's going to fade. We just don't know exactly when. So again, getting the vaccine, even if you've had COVID, is just kind of like an insurance policy, like saying I'm going to boost the immunity that I already have.
Now, the vaccines aren't 100% effective, and people say, if I can still get COVID if I get the vaccine, why should I get the vaccine?
Yeah, so there's no guarantees in life, and that includes with the COVID vaccine. The vast majority of people who are getting COVID in the United States right now are unvaccinated. By far, the vast majority of people who are dying of COVID are those who are unvaccinated. Depending on exactly which study you believe, roughly half of Americans aren't vaccinated right now, but those half of Americans are accounting for about 99+% of the COVID deaths that we're seeing. So again, this is all a numbers game. If you're going to do what really lowers your risk the most, it comes down to getting the vaccine. And again, if an unvaccinated person gets COVID versus a vaccinated person, the unvaccinated person is more likely to wind up in the hospital, is more likely to die, is more likely to wind up with permanent disability. So again, there's no guarantees, but it's just a much safer bet to get the vaccine.
And now we had dozens of questions about the COVID vaccine, and we obviously can't get them here today to all those answers. So what do you have to say to those people who still might have questions?
I think anybody who really wonders about the COVID vaccine or who is honestly just dead set against it, here's what I would tell you. I'm a physician, but I'm a human being. I have a family. I have a grandmother who I love. I have aunts. I have uncles. I'm very active in the community of Murfreesboro. I love my community. And I recommend the vaccine not just because I want to keep myself and my family safe, but because I honestly think it's what's best for the community and for my loved ones on the whole. 95% of doctors got the COVID vaccine the first chance they could get. And another 4%, for a grand total of 99%, are vaccinated at some point. So, and if you think that we're doing this as some sort of sham, as some sort of political ploy, as some sort of manipulation, it's just wrong. We got the vaccine by and large because we believe in it and we really do want to keep people safe and we believe in the science behind it. I wouldn't put my own body at risk. I wouldn't put the bodies of my wife and children at risk. They got vaccinated just as soon as they could. And that's the case for, again, the vast majority of physicians' families. So when you talk about health experts in the United States, you're talking about physicians. And what do most health experts in the United States do? They get the vaccine the first chance they get, and they get their families vaccinated the first chance they get.
All right, well, thank you, Dr. Ripperda, for being with us today. It was a pleasure as always. And for more information on frequently asked questions about the vaccine or where you can get your first dose, you can visit our website at wsiltv.com/coronavirus. In the studio, Madeline Parker, News 3.